Good afternoon. Thank you for taking the time to do this health assessment with me today. For the record, could you state your name and date of birth, please?
Yes, my name is Eric Katzenbach, and I was born November 9th, 1993.
Perfect. Thank you. All right. The first thing I'm going to be doing is a symmetry assessment of your head and facial structure. So if you could lean towards me for a second. Okay. The face is symmetrical. There are no wounds present, no nodules or lesions of any kind. Hair is uniform. There's no presence of balding or thinning spots. There's no lice. There's no dander. And that includes in the beard as well. Okay, now we're going to be assessing your eyes. The first thing I'm going to do on you is assess for the red eye reflex. So if you could look towards me a little bit closer. Okay. Red eye reflex is present in both the left and the right eye. And now I will be assessing for constriction and dilation of the pupil. It's going to be a little bright, so I need you to stare straight ahead for me, okay?
Okay.
I know. Okay. Pupils are equal, round, and reactive to light and accommodation. They're about 3 millimeters in size. They constrict when the light is close, and they dilate when it is farther away. Now I'm going to be assessing the conjunctiva, which is the inner lining of like the eyelid and around the eyes. I need you to come close again. You can keep your eye open. Okay. The conjunctiva is free from any nodules or scarring. It's pink and it is moist. Okay. The sclera is also white and intact. Okay. Now I'm just going to be assessing your ears. So if you can move towards me and turn to the side a little.
Okay.
The first thing I'm doing is assessing the pinna. I'm folding it up and assessing behind. There are no lesions, tissue, scarring, or nodules present. And now I am going to be assessing inside the ear canal. Okay. The ear canal is clear and free of any abnormalities. There's no nodules present. There is some earwax, but it is not an excessive amount. It is yellow in color. There are no use of hearing devices, and hearing seems to be relatively intact on this patient. Now we're going to be doing the Rhine and the Weber test. So the first thing I'm going to be doing is clicking this and putting it center on the top of your head, and I need you to tell me if you hear it uniform in both ears or more to one side or the other. Okay?
Oh, okay. I hear it, but it seems like it's even maybe a little bit more on that side.
Okay, so a little bit more on your left side.
Correct. Yeah.
And now I'm going to be doing the Weber or the Rhine test, which means I'm going to be placing this after it's hit in front of your ear and then also behind on the mastoid bone, which is just directly behind your ear, okay?
Okay.
And once again, tell me when you stop hearing the sound.
Okay. Okay, stop.
Okay.
Oh, it stopped.
1 second.
Okay, stop.
Okay. The skin is intact on the ear as well. Now we will be assessing your nose, okay? So if you can come towards me, I'm just going to point the pen light up. You might want to close your eyes so it's not affected. Okay, the nasal septum appears to be intact. It is not deviated. The alignment is centered. There are no nodules or tears of tissue in the nose or near the nares at all. There appears to be a little bit of nasal drainage, but this could be in part due to this patient's allergies from summertime. Okay, and if you can open your mouth for me, please. And tongue down, and please a little bit with your jaw, just a little lower. Very good. The uvula is midline. The mouth tissue is moist and pink. And the nodules in the back of the throat, or the tonsils, appear to be uniform. They are not swollen and there's no signs of infection. They are in a regular shape as is expected. The tongue is pink and moist. If you could stick that out for me, please. The thrust is smooth and uniform. Okay. The teeth are white and free of any dental caries, and they are straight. The lips are pink without any signs of cracking, and the gum lines are pink and moist as well. Okay, so next I'm just going to be assessing your neck for range of motion and other things like your lymph nodes. So if you could just turn more towards me. Very good. And lean forward. You feel any tenderness here?
Nope.
Okay. No pain?
Nope.
The trachea is midline. There's no deviation noted. The lymph nodes are non-palpable, and there appears to be no pain according to this patient. Now we're going to assess your range of motion for your neck. If you can turn to the side for me, one way and then the other smoothly. Very good. Do you feel any tension when you do that?
When it goes all the way to like there.
Okay, so you do have a little bit of tightness in your neck muscles.
Yeah, a little bit more going that way.
Okay, so more on your left side. And now I'm going to ask you to touch your ear to your shoulder on each side as far as you can.
I can pull my arm up.
And then the other side. Very good. Okay, if I can see your nails, please. Okay. Nail beds are pink and they do turn white when being pressed. The cap refill is under 3 seconds. The nail shape is slightly convex with a 160-degree angle. They are uniform and they are all clean and trimmed nicely. Thank you so much for being a part of today's health assessment. I really appreciate it.
Oh, thank you.